brachiocephalic artery or trunk, right? Well, we got 1, 2, 3 branches off the arch. The first one is the brachiocephalic artery or trunk. Right common carotid will be next, right common carotid artery, and then right subclavian. I'm sorry, this is left. Left common carotid artery and left subclavian artery, and that one kind of hooks around like an arc. It does so on the right too, right? So there's the right subclavian and the right common carotid, but it's a branch off the brachiocephalic on the right. Remember that? Veins doesn't do that. So veins, we have 2 brachiocephalics, right? And they each branch into the 2. You see the branch right there? You see the branch right there. So that's a brachiocephalic vein on the right, brachiocephalic vein on the left.
So we only have brachiocephalus on their right artery.
Yes,
Okay.
but it's not called the right brachiocephalic because there's only one that's just called the brachiocephalic. With veins, it's called right brachiocephalic and left brachiocephalic. We just saw that was a question you just had in the homework. What is there 2 of and veins that there's only one of in arteries? It's brachiocephalic. Right, Rory?
You just did the right subclavian and the right common carotid.
Did that. And then we're doing arteries, right?
Yeah.
Okay, so there's your common carotid artery. It's good. Now we're on the right, so I'm not going to keep saying right. On the right? Yeah, on the right. Then the common carotid is going to go interior, and some of it's going to stay exterior. Right, so there's your interior carotid on the right, and there's your exterior on that side of the branch. Next.
The superficial temporal.
Superficial temporal. So we're just staying on the exterior. Superficial temporal. Just find your temples, which are right here. Right. So there's that external carotid becomes the superficial temporal. If you see number 43 there, that's the superficial temporal. You can feel a pulse on it. Right? You see these temples pulsating. Want me to get really upset so you can see it?
The facial.
Facial. Facial is usually the easy one because it kind of goes up the face. There it is. Lingual, well, there's the one that's kind of headed towards the tongue. See it right there? That artery? Point to again. Lingual artery.
Yeah.
Occipital, well, you know where your occipital bone is. It's back here. So there's your occipital artery. There's the branch going to your occipital area. Axillary means underarm, right? So the subclavian artery, we're on the right now, everything's right and left. Right? It becomes the axillary artery. I think that's where they have the number 50, right of that underarm area. Then we have thoracoacromial. Well, that acromion is the tip of the shoulder, which is kind of right here. So this is the thoracoacromial branch. It goes to the thoracics, then it goes to the acromion process. So it's the thoracoacromial artery. I stuck pulmonary trunk in here. It's kind of out of nowhere. You think we'd keep going down, right? Well, here's the pulmonary trunk. We know that from the heart. Right? It's the only blue artery that you'll... So, well, actually, the pulmonary trunk will split into the left pulmonary artery and the right pulmonary artery that goes underneath that and kind of comes out this side. Right? And those are your only blue arteries in your pulmonary circulation. Next. Pulmonary artery, remember there's a left and right. Left, right. Note, this is a blue artery, or the artery is blue, right, because it's pulmonary circulation. Covered that, fine. Yeah, where do we leave off here? Axillary artery. Right now it's going down the arm, so now it's called the brachial artery. And we got one little branch off here. See how it kind of comes this way, and then it kind of swings around underneath. There's a little twist behind the humerus. That's the deep artery of the arm. That's what it's called, I think. Yeah, deep artery of the arm. And that will run all the way to the elbow area, then it'll split into the radial and the ulnar, which radial is usually on this side, but see how its hand's not in anatomical position here. Alright, so that's radial, that's ulnar. This hand's in anatomical position, so we know that's the radial on the thumb side, and that's the ulnar on the medial side of the forearm. Right. Radial, ulnar. Abdominal aorta, right, that's the whole length of this big red trunk right here. It's the abdominal aorta. It's got a lot of branches, as you see, so let's go through them. Celiac trunk. is this first trunk, I guess. I'm trying to think of a different word, but there it is, celiac trunk right there. It's got 3 branches, but you can only really see 2 because one would be coming out towards us. Not that far, right, but towards the side. Splenic is one, which helps if you know this is the spleen. Right, so there's your splenic artery. Common hepatic helps you to know that this is the liver. Right, so we're following the red one, right, which is the common hepatic artery. Purple we'll do next class, which is part of your hepatic portal system. Stay tuned. Superior mesenteric. So there's your celiac. So the next big artery coming out right there, right, it's coming out the anterior side of the abdominal aorta. That's your superior mesenteric. That goes to your intestines, small intestine, and half your large intestine. Left and right renal, they're hard to see because here's the kidneys. You can see the veins, right? But if you look kind of behind the vein, right, there's your right renal going towards the kidney. You see that?
Yeah.
Can iPad see that? I'm not sure. And this is the, you probably see just a little bit of the left renal artery. And if I keep rubbing on it here, it might be all done. Right and left gonadal arteries. These are the ones that kind of run diagonally downwards. Right, so those are your gonadal arteries, left and right. And what I was saying on the board, I'm going to go to the veins right here. This is the gonadal vein. Right, here's your gonadal artery. There's your gonadal vein. See how it comes right up to it? It comes right up to this inferior vena cava.
Yeah.
Well, the one on the left comes up to the renal vein before it goes to this. There's little
Okay.
asymmetry there. That's what I was trying to explain. It's hard when you're trying to see a picture, right? 50 feet away. But there it is. Inferior mesenteric, well, we're just heading south. Now we're at the inferior mesenteric, so there's the artery. It's heading off to the left. There. That supplies the bottom half of the large intestine. Remember, superior mesenteric is small intestine and top half of the large intestine. Well, there's the blood supply to the bottom half of the large intestine. I think you have a picture that shows that in your textbook, in your lab manual. Common iliac, so the abdominal aorta ends right here, and it splits into a right common iliac and a left common iliac. And then the common iliac will split into an internal, see it going down there? So it's a right internal iliac, there's a left internal iliac. So now this is called the external iliac artery. Internal, external. External iliac becomes the femoral, because now this is the femur, right? So there's the femoral artery. We can go on this side too, femoral artery. Popliteal, you can probably tell me that one.
The
You can't see it here because the knee's covering it, but since he turned his foot nicely for us here, right, we can see the popliteal artery behind the knee. And anterior tibial, see how it comes to the front side of the tibia? Tibia is the shin bone here, so that's the anterior tibial, and there's the posterior tibial. So if we're looking at this view here, there's your anterior tibial coming to the front. You can't see the fibular. It's not shown here, it's not shown there. This is probably a branch going there, but we don't know, so just leave it. So we didn't put fibular artery on this list. Dorsalis pedis, well, there it is, right on the foot. Good, see it there too.